Hello and welcome to Medicare 101, your complete blueprint. Medicare can feel like trying to program the VCR in the 1980s. You push a bunch of buttons, the clock's flashing 12, and you still don't know if it's set to record the Dallas finale. Great. Now I'll never know who shot JR. But here's the good news. After watching this video, you will know more about how Medicare works than most of your friends and family members. And trust me, once you're done, they'll be calling you the Medicare guru at Thanksgiving dinner. Right after Uncle Bob finishes telling the same story about Woodstock for the 12th year in a row. You know what I mean? This is not a sales pitch. No celebrity endorsements. I'm looking at you, Joe. No giant 1-800 numbers on the screen. This is Medicare explained like we're sitting at the kitchen table, minus the plastic cover your mom used to keep on all the chairs. I'm not here to push you into one plan or another. I'm here to explain how it works so that you can make the best decision for you. Think of me like your Medicare translator, because sometimes it feels like Medicare was written in another language, possibly Klingon, except for I understand Medicare. So grab your coffee, maybe a pen, and let's dive in. Confused about Medicare? You're not alone. Medicare can feel more complicated than trying to dial a rotary phone fast enough to win a radio contest. In this video, I'll break down Medicare 101 in a way that's simple, clear, and even a little entertaining. What you're going to learn: how original Medicare, Parts A and B, really works, what Medicare doesn't cover, and how to fill those gaps. Medicare Advantage versus Medicare Supplements, which one's right for you? Prescription drug coverage, Part D, explained. Enrollment rules, penalties, and timelines you can't miss. And then how to avoid thousands in surprise costs. Why watch me? I'm not here to sell you. I'm here to be your Medicare translator. My brand promise is compassion, clarity, and comfort. And that means that I'll listen, explain your options clearly, and make sure you never feel alone in this process. Original Medicare, a brief history. Medicare was signed into law in 1965 by President Lyndon Baines Johnson. The first recipient was none other than President Harry Truman. Imagine that. The guy who dropped the atomic bomb ends up being first in line for paperwork. That's retirement for you. Back then, the card even had your social security number on it. Because in the 60s, nobody worried about identity theft. The theft you were worried about was somebody pocketing your S&H green stamps you'd been saving for a new toaster. Fast forward to 2018, and someone finally said, hey, maybe putting millions of social security numbers on little paper cards wasn't such an odd idea. Now you get a randomized alphanumeric number instead. Oh, and get this. Part B used to cost just $3 a month. $3. Today, it'll barely cover a skinny iced no-whip blonde vanilla latte with extra almond milk, 2 Splendas, and your barista rolling their eyes at you. Who qualifies? There are 4 main ways you qualify for Medicare. You turn 65. That's the big. You've been on disability for 24 months. Ouch. You have end-stage renal disease. You're diagnosed with ALS or Lou Gehrig's disease. That's it. 4 doors in. Not 5, not 6, 4. Kind of like the Beatles before Yoko. And remember, Medicare is always individual. Even if you're married, you each get your own plan, your own premiums, and your own bills. Medicare is equal opportunity like that. Part A, coverage and costs. Well, Part A covers. Part A is your hospital coverage. Think of it as your rent for the hospital room. It also covers skilled nursing facilities, some home health care, and hospice. But don't get it twisted. Skilled nursing is not the same as a long-term nursing home. Think of it more like rehab. You go in, you get better, and then you get out. Kind of like when you sprained your ankle doing the twist at your high school reunion. Here's the good news. Most people don't pay a monthly premium for Part A. About 99% get it premium free because of those payroll taxes you've been paying your whole life. Remember when you used to look at your paycheck and think, what's this FICA tax line? Surprise! Some of it's for this. If you or your spouse worked at least 10 years paying into the system, you're covered. If not, you may pay a premium that depends on how long you worked. This cost changes, but here's this year's numbers. Let's talk about gaps in Part A. Here's where it gets tricky. See, Part A has a deductible, but it's not yearly like you're used to. It works in 60-day benefit periods. This is the deductible amount this year. That means if you go into the hospital in January and then again in April, you may owe the deductible twice. It also means that if you shatter your wrist doing a cartwheel with the grandkids in the backyard, not that that's ever happened in my own family, and go to the hospital for a few days, and then get out, and then you break your coccyx jumping into the pool off of the roof because Frank triple dog dared you to. And now you're going to pay that deductible twice. So let's go ahead and not do that. Part B, coverage and costs. What Part B covers? Part B covers your medical services, your doctor visits, your outpatient care, tests, therapies. If Part A gets you in the building, Part B is what happens once the doctor actually walks in. And of course, he's going to ask you the same questions that you already told the nurse in the waiting room twice. Unlike Part A, Part B has a monthly premium. This is the standard premium for this year. Most people pay the standard amount, but it goes up if you have a high income. The government calls this IRMA. IRMA can be quite the expensive lady. IRMA stands for Income Related Monthly Adjustment Amount. Like a lot of things in the United States, Medicare is also income adjusted. It is based on the last full year of tax information they have available to them, 2 years prior. Now, there are a ton of strategies around this that won't be covered in this video because that is a full playbook all by itself. And listen, what you and your CPA do behind closed doors is none of my business. In this instance, my name is Paul, and that, my friends, is between y'all. Well, y'all and Uncle Sam. So yes, the more successful you are making money, the more you're going to pay for Medicare. Congratulations. Gaps in Part B. Part B has a deductible. After that, it pays 80% of approved services. You pay 20%, and there's no cap. Yikes. If your care costs $1 million, which I have seen multiple $1 million bills from different ICU stays of my own, your share is 200 grand. That's enough to buy a timeshare in Barbados, but instead of an amazing beach view, you get a hospital gown that doesn't tie in the back, leaving your posterior hanging out in the breeze, just like original Medicare if you don't do something to protect yourself from the potentially devastating gap in coverage. And remember, Part B doesn't cover dental, vision, or hearing. Apparently, Congress doesn't think it's important to be able to eat, see, or hear after 65. I guess they're expecting us to communicate by lip reading at the Longhorn Steakhouse. I mean, they won't blend up my Parmesan crusted chicken and asparagus into a smoothie for me. Trust me, I asked. I even know a guy. Still a hard no. So, spoiler alert, dental, vision, and hearing are important. Filling the gaps. Advantage plans versus supplement plans. Here's where the Medicare showdown begins. So Advantage plans versus supplement plans. Coke versus Pepsi. Beatles versus the Stones. Ginger versus Marianne. Ford versus Chevy. Let's start with Medicare Advantage because just like Pepsi in the 80s, they've got commercials everywhere. And sometimes even a celebrity or two trying to sell you on it. I mean, stick to football, Joe. I kid. Don't come for me, Mr. Namath. Respect. Medicare Advantage, Part C. Medicare Advantage plans are run by private insurance companies. Medicare pays the private insurance companies to manage your care due to the fact that they can often do it less expensively, as the federal government is notoriously awful at catching fraud and waste. They will bundle your hospital, medical, and often your prescription drug coverage together. Many come with perks like dental, vision, hearing, and even gym memberships, which is perfect if you've been looking for a socially acceptable reason to wear headbands and tube stocks again. No? Just me? Okay, moving on. The big draw? Most Advantage plans have $0 premiums. But remember, nothing in life is truly free. You'll pay through copays, coinsurance, and network restrictions. You will also have to pay your Part B premium. There is no getting out of that. Although in some areas, you can find a Part B give back plan, which will refund some of your Part B premium every month. HMOs mean you have to stay in network. PPOs give you more flexibility, but you'll pay more if you go out of network. And yes, you might need prior authorizations, which is fancy speak for waiting on hold, listening to Kenny G for 45 minutes while somebody decides if your MRI is medically necessary. Medicare supplement, also called Medigap. These are the same thing. Supplement plans are kind of like buying a Buick back in the day, right? Reliable, steady, and you know exactly what you're getting. Plan G from one company is the same Plan G from another. The difference is in the company's track record, right? So some roll in like a flashy new Lambo with low rates the first year, but by year two, they're burning oil and cost you more than that Buick would have. The upside, you can see almost any doctor in the country that accepts Medicare, and about 99% of them do. No networks, no referrals, no begging. Downside, you'll pay monthly premiums, usually $100 to $300 per month, and they don't include extras like dental or vision. So if you want your teeth covered, that's a separate plan. Also, any prescription drugs you take are also not covered, and the premiums will almost certainly increase as you age. If you choose this path, dental, vision, hearing is something we need to look at, and Part D is necessary. Unless you have credible coverage from another source, you don't want to pay a penalty for late enrollment into Plan D when it is entirely avoidable, which is a perfect segue into Part D is prescription drug coverage. It's voluntary, but if you delay and don't have credible coverage, you get hit with a lifelong penalty, 1% per month that you waited. It's kind of like late fees at Blockbuster, except these never go away. Drug plans have three phases. The first, you have the deductible phase. You pay out of pocket. Then you have initial coverage, which involves copays and co-insurance. And then you have catastrophic coverage, which starting in 2025, once you've spent $2,000 out of pocket, you're done for the year. But remember, not every drug is covered. Each plan has its own formulary, which is just a fancy word for its list of drugs we are willing to cover. Always check your prescriptions before enrolling. I make this step my top priority when helping find your Part D or Medicare Advantage plan because drug costs are often the biggest worry for people, and selecting the right formulary can be the determining factor on whether you spend a few bucks every month or hit your 2,000 max out of pocket on drugs this year. It really is that important. If you choose Medicare Advantage, most plans will have drug coverage. But again, start with your prescription drugs. Do not look at plans without entering your medications. The worst thing ever is you choose or you switch to a plan because it had a grocery or transportation or some other benefit that sounded great. But you are paying your whole 2,000 out of pocket in January because your drugs aren't covered. And yes, this has happened. Please don't let it be you. If you see a plan you're interested in, call your agent to have them walk you through it. I've seen plans advertised that only a handful of people will actually qualify for, as the old bait and switch. Please call us at Medicare 411, phone number in the description, or call your local trusted agent. There are a ton of great, caring, local, independent agents out there, and it won't cost you a thing, but it could save you from making a mistake that could cost you thousands every year. HSAs and Medicare. If you have an HSA, listen up. The IRS says you can't contribute to your HSA once you're on Medicare, not even Part A. And Part A is often backdated up to 6 months when you sign up. That means you'll want to stop contributions before enrolling, or you could face tax headaches. You can still use the money for qualified expenses like copays and advantage premiums, but not for supplement premiums. Why? Because the IRS said so. And let's be real, arguing with the IRS is about as productive as yelling at your TV during Wheel of Fortune. Might make you feel better, but it's not going to do anything. Automatic enrollment. If you're already taking Social Security before 65, Medicare will enroll you automatically in Part It's A and B. Your card will show up in the mail about 3 months before your birthday. If you're still working and covered by employer insurance, you can opt out of Part B, but you have to do it on purpose. If you do nothing, you're in. Now, if you're not taking Social Security, when you hit 65, Medicare doesn't just automatically show up with balloons and a birthday cake. You have to raise your hand and enroll yourself. The window is 7 months long. 3 months before your 65th birthday, your birthday month, and 3 months after. This is called IEP, or your initial enrollment period. And if you miss that, you could be stuck waiting until the next enrollment period. And worse, you might get hit with penalties. So if you're not on Social Security yet, mark your calendars. The easiest way is to go to ssa.gov and sign up online. Or you can call Social Security, but I'll warn you now, that call can last longer than a Pink Floyd concert. Final thoughts. Here's my biggest piece of advice. Start early. You can begin enrolling 3 months before your 65th birthday. Do not wait until the last week. This is the federal government we're talking about. It's not exactly Amazon Prime shipping. Second, work with an independent broker. Agents don't cost you anything. They're paid by the insurance companies, and a good one will stick with you for life. Just make sure they represent multiple companies so they're showing you options, not just what pays them the most or the only option they have in some cases. Medicare isn't one size fits all. Your health, your finances, your lifestyle, they all matter. The best plan for you might be totally different from your neighbor or in some cases, your own spouse. So now you know. You're practically a Medicare expert. But remember, with great power comes great responsibility. And no, that wasn't Uncle Sam's Medicare. That was Uncle Ben in Spider-Man. But here's the bottom line. Medicare isn't one size fits all. That's why we start with you, your prescriptions, your doctors, your pharmacies, and your needs. Medicare doesn't have to be confusing, and you don't have to go through it alone. My name is Jeremy Foltz, and I am your Medicare translator. My mission is simple: to bring you compassion, clarity, and comfort every step of the way. If you're ready to sit down and walk through your options together with no pressure, just honest advice, I'd be honored to help you.